Good afternoon and welcome back to our daily briefing. As we do, we're joining you here every day. I'm joined by Chairman Mark Kern and Samantha Bierman from the Health Department, and Sam will be starting with our daily numbers. Sam, thanks for joining us.
Absolutely. Thank you for having us again. So as we have done in days past, the numbers that we will be reporting to you today are St. Clair County residents that have been tested, and we are at 2,847 that have currently been tested, with 667 positive test results, which is an increase of 46 from yesterday, and that includes both males and females from their teens to their 90s. We are at 2,131 negative test results, with 49 tests still pending. We do have some sad news to report today. We are going to be reporting an additional 2 deaths, which is a total of 55, and the 2 new deaths were both males in their 80s who did have underlying health conditions. And as always, our thoughts and prayers go out to those families. For state totals, we are at 379,043 that have been tested, with 70,973 positive test results, which is an increase of 2,641 from yesterday. And for deaths, we are at 3,111, which is an increase of 137 from yesterday. For hospitalization numbers, and these are for hospitals that are in St. Clair County, we are currently at 51 patients that are hospitalized due to COVID-related reasons, and 6 of those patients are currently on ventilators. For the congregate living facilities that are in outbreak status, and that means 2 or more staff or residents that are either COVID positive or who have COVID-like symptoms, Berea of Belleville has 20 cases and 2 deaths. Berea of Cahokia has 5 cases and no deaths. Caritas Family Solutions in Belleville has 6 cases and no deaths. Colonnade of O'Fallon has 3 cases and no deaths. Four Fountains in Belleville has 79 cases and 13 deaths. Help at Home, which is in O'Fallon, has 5 cases and no deaths. Lebanon Care Center in Lebanon has 34 positive cases and 7 deaths. Memorial Care Center in Belleville has 43 cases and 5 deaths. St. Paul's Home in Belleville has 5 cases and 1 death. And TDL Incorporated in Belleville has 4 cases and no deaths. And now I will turn it over to Chairman Kern for his update.
So I guess everyone's noticed today Herb Simmons is not with us. He's taking care of a personal matter, and he'll be back tomorrow. So don't worry, Herb is doing fine, and he's going to be back here tomorrow to check on all of you. And you need to check on your friends and your family and your relatives to make sure they're okay. Let's just remember that we're all in this together. Socialization is a big thing that we're missing during this time. We're going to get back to it, but in the meantime, make sure that you remember to check on people. They'll appreciate the conversation. When you're out and about, remember to wear your mask. It's important when you get near people or around other people that you have that mask on, not only for your protection, but for their protection. And when you're out, don't throw your gloves on the ground when you're finished with them. Make sure you dispose of them properly. Someone has to pick them up. Somebody's going to have to clean them up, and that's just starting the spread of something new. So at this time, let's try to not start spreading anything new. What we need to do is to fix the spread of COVID-19. The zip code reports are here, and we'll go into them now. 62201, we remain at 12. 62203, we remain at 24 COVID positive diagnoses. 62204, there are 30, that's an increase of 2. 62205, there are 30, that's an increase of 4. 62206, we have 59, that is an increase of 2. 62207, we remain at 33. 62208, we now have 39, that is an increase of 2. In 62220, we have 63. That is an increase of 4. 62221, we have 52. That is an increase of 6. 62223, we now have 38. 62226, we have 81. That's an increase of 2. 62232, we remain at 7. 62239, we remain at 10. 62254, we now have 19. That is an increase of 1. 62257, we remain at 7. 62258, we remain at 14. 62269, we have 54. That is an increase of 2. And 62285, we remain at 6. And remember, just because you didn't hear your zip code doesn't mean you don't have any COVID positive people in your zip code. What it means is it hasn't risen to the level above 5 yet. So today we've got a familiar guest. Phil's been here before. Phil Pugh is the Emergency Management Director with Belleville Memorial Hospital, and he's the Regional Hospital Coalition Coordinator from EMS Region 4, and that serves not only St. Clair County, but 11 total counties and 17 hospitals.
Yes, sir.
Welcome.
Hey, thank you. Glad to be here.
So just initially, tell us how are the hospitals responding to COVID-19? If you're giving a grade out, what's the grade?
If I'm giving a grade out, I'd have to say they've met the challenge. The hospitals around our coalition have met the challenge and in our region. As a retired airman, I'm wearing my retired Air Force shirt on
Thank
today.
you for your service.
I get that all the time, and what I would say is that that's normally for going out deployed and being on the front lines. I use air quotes as I can. But today, it's our nurses that are on the front line. It's the patient care techs. It's the environmental services folks in our hospitals that are on the front lines providing patient care. And I would be remiss if I didn't say it now, but it is National Nurses Week. So if you can, say thank you to a nurse when you see him or her as they're downtown, because they are right there taking care of business and taking care of our patients, family members, brothers and sisters every day.
And they're going home at night, and their families, you got to probably thank the families too. They're the ones who are allowing their loved ones to go out, and when they come home, a lot of the nurses we've talked to on here, they disrobe in the garage and throw everything in a trash can, try to keep everything separate from the family.
They're definitely trying to protect the home as well as protect the public.
So when you say EMS Region 4, can you give us numbers so that people can kind of understand what your region consists of, and then what are the numbers in the total region? Because the region is how the governor is going to look at reopening the area. He's not just going to look at St. Clair County numbers, he's going to look at the region.
That's true. So our region starts right at the border with Missouri, right here in St. Clair County, and goes as far east as Fayette County, goes up as far as Jerseyville, and goes as far down as Randolph County. I'm sure I got somebody a little further south than that, but it goes that far. And the hospitals that we have across that region today collectively, as I reported this morning, yesterday was a new low for us with COVID positive patients and PUIs and persons under investigation. We had a total of 80 across all of our hospitals, across all 17 hospitals. As you can imagine, with the high population density that we have here across the Metro East, most of that is considered right here in St. Clair County, Madison County, those two areas because of the population. And we have started to see some of those numbers start to trickle out into our rural communities and our critical access hospitals that had no positives or COVID or PUIs in the past. But what I can say is overall, that 30-day low yesterday to me was a great sign that we're on the right path, and if we can continue to follow the protocols that the governor's put out, that IDPH has put out, that you yourself are trying to ask our citizens to do, that's just going to keep driving those numbers further and further down as we go forward.
And so the risk is that we get down and then we loosen up and then it comes back.
Exactly. You have to remain vigilant. I'm sure there's going to be a new normal. I know you've heard that probably several times before, but how we interact with people in public is going to be probably different with or without a vaccine over the next 5 years. We always talk about how 9/11 changed us. I'm sure this is going to change folks that never had to deal with it. If you ever lived maybe in Japan or China, Singapore, or Korea, their cultures are totally different. They do things a little different now. They're not just wearing masks day to day for smog or anything like that. They've been through it a couple times before us, and their cultures have shifted a little more. We're probably going to have to shift the same way when we come out on the other side of this.
One thing that surprised me from the outset was that we were, in a sense, fighting state by state for personal protective equipment for our first responders. Some of that has been solved. Talk about that situation and the number of requests that you have filled in your region.
Sure. So as the regional hospital coordinator, we're responsible to assist our resource hospitals. We have 6 resource hospitals across our region, and then they have associate hospitals and EMS agencies that report to them. As they get requests for support, if they can't fulfill it at their hospital level, they come to us. So to date, I think we've just fulfilled over 118 resource requests, and that's anywhere from gloves, isolation masks, gowns, all the PPE that you hear that there are shortages of. We've helped facilitate that. Now, did Memorial Hospital buy all of that? No, by no means. We're supported by the Strategic National Stockpile and the Illinois Pharmaceutical Stockpile, which provided those assets to you. So a lot of that is your taxpayers' money that's gone forward and has gone back out in a time of crisis. So while some of that is on the agencies and the organizations, they are buying that. We all know that the supply chain kind of could not keep that demand, and we found numerous ways to try to keep up with that demand, from reusing certain types of personal protective equipment and reissuing that in a safe and effective manner. So there's been a lot of ingenious things that have come out of this. So again, on the other side of this, there are going to probably be ways of how we're going to work within a hospital that may say, well, we didn't do that 2 years ago. Look, we found a solution in the time that normally would probably take 5 to 10 years. You figured it out in less than 60 days, and now we're probably going to keep some of those things in place.
So the public really, a lot of the members of the public came to bat. We had a local distillery that made hand sanitizer. A lot of people are out there making masks. Is there any item, still a PPE item that you are short of?
The one thing has been gowns. Okay, so there have been creative ways to try to fulfill that, but it's been the hardest. Some supply lines have been able to keep up with them, but isolation gowns are the number one. Now, there are not a lot of folks that are in hospital settings or healthcare settings that are using a reissue method with those gowns. They're not reissuing those. They like to have those that they can be discarded of when they leave. But I would say that if you can institute a form of reissuing of reusable gowns, because we have some success stories across the region. While I'm in Memorial, I can tell you right now that our good folks at St. E's have come up with some very good, ingenious ways and safe ways to do that. Those are wins. Those are things that we're going to come out on the other side and say, this was an improvement area. This is something that we may be able to benchmark at a later date in time when we're not in a crisis. So gowns are the one thing. And good news that I did get from IDPH today. I know Dr. Ezekiel and Governor Pritzker, they announced that we have gowns that the state has procured, and they will start shipping those out to long-term health and to hospitals starting on Monday. So that's going to fill a needed void that we've been struggling with for the past, I'd say, 30 days. That's been the one thing that we struggle with the most.
So you got recommendations to slow the spread? I mean, so you said that now all of a sudden, or not all of a sudden, but we're now seeing a spread that is actually occurring in the rural areas. So there really is no area that's untouched. How do we slow and stop this spread? What would you say?
I'd take your advice. Continue your social distancing. We do ask that when you're coming to a hospital or any healthcare organization, a private physician, come there with a mask on. I wouldn't think that they're not going to give you a mask. They're going to provide you a mask, but we already talked about supply side shortages. That is a key help. Continue to wear your isolation mask while you're out in public. Practice social distancing, and as your mom would have probably told you when you're 5, wash your hands. I can't stress it enough. That's gonna probably kill this disease quicker than anything else.
So elective surgeries. Are they about ready to ramp up and start? And what's the process? Are they going to be tested before they go in for the elective surgery? Tested for COVID-19 before they go in?
Yes. So that is a requirement from the state that you must have a test within 72 hours of your surgery. Surgeries will begin at a multitude of facilities. I know at Memorial Hospital we're going to be starting on Monday, the 11th. So that's happening across the state. It's also happening on the west side of the river as well. They're preparing for those surgeries to begin on Monday as well. So that test needs to come back within 72 hours. So it can't be 74, can't be 75. Can't be 7201. It needs to be within 72 hours. We want to make sure that you're getting those test results prior to surgeries. There's a lot of folks that have had to hold off, obviously, with elective surgery. So whether it was your back, knee replacement, joint replacement, and those are being prioritized. But I can tell you right now that folks are calling up. They're getting scheduled, and they will get their surgeries sooner rather than later, I'm presuming now that we're here.
So we talk about testing. So now really virtually anyone is eligible for testing. I mean, there are some areas that have certain requirements, but we know a number of the facilities you drive in, you're going to get a test. What does that mean? Why should people want to get a test even if they don't feel that they have symptoms?
Well, I think there's a few reasons for that. One is that there's probably a personal reassurance that comes along with that. You may be in a household with an elderly parent or someone with an immune disorder, and you don't want to be around them. You may work public transit or something like that. Maybe you've taken every precaution that you know of, but you want to be sure. It gives a little bit of sound peace of mind. The other reason is it's going to provide us the ability when they start talking about contact tracing. I'm not an epidemiologist or anything like that, but to know that, okay, we have a small group of folks here that could spread maybe in a highly dispopulated area, it would let you know that, oh my gosh, I am now potentially positive and I need to limit my movement and I need to seek treatment when I feel that cough. I feel like I'm having that fever, or if I feel like I'm in pain. And that's going to help us identify those locations, help public health, and slow the spread of of the virus.
In contact tracing is nothing more than you came in contact with someone who was tested positive. They said, hey, I saw Mark and I talked to him for more than 10 minutes, and I would get a call that said, hey, shelter in place, Mark, you were exposed. That's really what contact tracing is.
There you go.
And then that isolates this germ so that Mark doesn't go out and then give it to others unknowingly.
Exactly.
And the more we do that, the more we're going to be able to get back to our normal lives.
Exactly. And as testing does expand here in the southern region, between here in the Edwardsville region and the Marion region, I'd say that I just encourage people to get tested if they can. Not everyone is going to meet some of the requirements, but when you find an organization that will provide you tests without a requirement, go ahead and get the test done.
They're free, and a lot of them, they hand you the swab in the window, and you put it in your nose yourself, and it works.
Yeah, well, I hope not to do that myself. I don't want to get. I look at it every time. I probably should go get tested myself just so I can go through the experience fully. I think I had a flu test years ago, but this one is just a little bit different.
Somebody told me it tickles a little bit.
Tickles a little bit. There you go.
So in the testing and the tracing, that's an interim step before they get a cure and a vaccination.
Exactly.
And those things are being worked on right now.
Exactly. And there's plenty of news articles out there, a lot of promising things on the horizon. So I would just keep in tune with the CDC and the World Health Organization because they're going to be pushing that information out almost daily. And when we started this, there was something changing every minute. Now we're getting to a point where we're starting to see daily changes in whether there's remedies or new drugs that are being dispensed. That's happening at a rapid rate, and that's a good thing. That's a really good thing. So hopefully we're closer to the end of this than we were yesterday. So,
well, I appreciate you being at the helm during this time. That has meant a lot, and we got a ways to go, but we're going to get there.
Cool.
Brian, you got a question?
I do.
You going to try to be Herb?
I'll try and fill that role today. Actually, a couple things that came up as you guys were talking. One thing you mentioned was yesterday you got back to the lowest number you had within 30 days for the hospital as a region. Do you attribute that to anything as far as changes in what we've done, or is that because the virus is leaving the area?
I honestly think it's really because people have taken it seriously. I think that as a state, while I think the governor said that he probably wished they'd went a little faster, a little earlier, I think when we instituted our isolation protocols here in the state, people took it seriously, and that's the only thing I can really attribute it to. I definitely can't say that people are going to seek treatment who are sick. They're going to come to the hospital, and the physician is going to evaluate you and determine if you need to be an inpatient or you can go home and self-treat. The fact that we're seeing less and less and less in the hospital setting, I can only be attributed to people taking it seriously and not coming across the disease initially. Now, folks now are getting to the point that once they are admitted, their length of stay is shortening, which is a good thing. That's a good thing. So if we're having more discharges at a more rapid rate, treatment is getting better. So doctors are learning, just like any artificial intelligence out there in the world. They're some of the smartest people in the world. So they've taken note and said, well, this didn't work, this didn't work, this did work, let's try more of that. And that's where we're at now. So the length of stay in the hospitals is becoming shorter. So that's a good thing. But people taking it seriously is the number one reason I would attribute to personally why we're seeing less in the hospital settings.
And that kind of goes to what Chairman has said, that now's not the time to take your foot off the accelerator. We need to keep being vigilant, keep following
Exactly.
those regulations that are there, because this is evident that it's working.
Exactly.
And now we can start ramping up that second side of this with the testing and more aggressive contact tracing.
Exactly. And if you hear lots of time a potential second wave of this, that can only occur if we forget all of what we've learned so far. That can only occur if we forget what we learned so far. You can almost wait it out. You can almost wait it out. People are getting a little stir crazy. You see that online every now and then. But if they just be patient, we can make it through it. We're almost there.
Great. Well, thank you for joining us today.
Thanks, Phil. Very
Thanks
much.
for having me.
Thank you all for joining us. As you heard Sam say earlier today, as far as our positive rate today, we had a sharp increase up to those 46 new positives, the unfortunate loss of a couple more lives. We're going to stay vigilant with this. We ask you to stay vigilant with this. Continue practicing that social distancing. Continuing following those regulations that are there. Wear a mask if you have to go out in public. As you heard Mr. Pugh say today, it is working, and it's working with your assistance. We thank you all for doing that. Stay with us a little bit longer. Stay home and help us get through this. We'll be back tomorrow at 3:30 with our daily briefing, and back shortly with Daisy and Cindy, who will translate this for our Spanish communities. Thank you.